Good morning, Professor Singh. Thank you so much for your time. It's a great honor to be speaking to you today. The pandemic has grappled the entire world and has devastated millions of people. Firstly, I would like to start with by asking, as a mental health expert, what are the safety measures one should take during these challenging times?
What is the impact of the pandemic on the mental health of society in general in UK, and in particular on young people, school age, and students at universities? We don't yet fully know the impact of the pandemic on people's mental health because it's evolving. It'll take us a long time to work out what it is, but there are some things we can say now. And
Right.
one thing is clear, that it's having a very detrimental effect on the mental health of society in general, but also those who were already suffering from mental illness. So if I separate the two, if we just take people generally in society, our natural human response to any crisis is to huddle with each other, to seek comfort with those we love, those we are close to. The biggest tragedy of this pandemic is that we've been separated from each other. We've been isolated from each other. People can't go and see their children or their parents or their grandparents. So that enforced isolation at a time when you need the comfort of your loved ones has been one of the biggest problems, in my view, for society, whose impact will turn out, long term. It may, we may pull together, or it may be that some people are really really suffer long term from this isolation.
Mm.
Then uncertainty. Human beings can deal with lots of difficulties and adversities, but uncertainty is not one of them. If that's why that thing of the sword hanging over your head,
Mm.
if the sword falls, you know what the damage is, and then you can go ahead and try and repair it. As long as it's hanging, it's very distressing. So we have absolutely no way of knowing how long this will last, how it'll end, whether it'll end, and what the future will look like.
Mm.
So that's a general worry that everyone has. Specifically, so many people have lost their loved ones. So many people have lost their jobs. There are
Mm.
families where you have a double, triple whammy of illness in the family, bereavement in the family, loss of income, loss of structure, and isolation. These are, each one individually
Mm.
is very distressing. In combination, I think we have a hidden pandemic of mental health.
Mm.
You can understand why. You've got to first not catch COVID. And if that requires being on your own, that's a price to pay. But I think underneath the COVID physical crisis, there's an enormous mental health crisis going on.
Yes.
The biggest contributors at this stage are isolation, worry, uncertainty, financial problems, and of course, restriction. Imagine a young family with two or three children in a flat. They
Right.
haven't been out for days or weeks. They had People haven't been away from holiday um, for about a year now. And I personally have noticed that working from home is not all pleasure and leisure and good, because there is no longer a separation of work from home.
Mm.
You used to be able to finish your work and walk away.
Yes.
And working from home, for all its advantages, I think will have disadvantages, which will become apparent over time. And in your work environment, the social interaction, the coffee breaks, and all that human side of work, which makes it fun, even if the work is difficult, all that's gone. And I
Mm.
think work from home is going to have some adverse consequences. Your point about young people and students is particularly significant. I have young children both at school and university, and I can see their struggle. I haven't seen my daughter for a very long time. She's at university. We speak, we are in touch, but we are isolated from each other. I would love to give her a hug. I can't. My children, my wife and I are both doctors. We have the option of sending our children to school because we are key workers. But we have to balance the worry about exposing them to COVID against the worry of them being isolated from their friends. We don't know what to do. For students, I think the educational impact is going to be enormous. I'll make a general point, which is not a popular point, but I think it needs to be made. COVID affects largely the elderly. The highest mortality is in the older age group. So over 80, you have 8 to 10% mortality. I don't know the exact figure, it's around that. Now it is absolutely right that we look after that population. But our current plan or current system says stop everyone from going out. There is an alternative, which is protect the vulnerable, but let the rest of us carry on with our lives. Now, there is a risk to that, which is exposure to the illness. But there is also a risk to not doing that, which is the long-term damage to the economy, which again is for our children. Long-term impact on our children's mental health, on their educational achievement. So I think we will have to come to a reasonable agreement that a permanent or a long-term lockdown is not going to be helpful. You can see why you would want to have a lockdown, but you can't keep having, society can't be locked down forever. And we are not going to have a post-COVID state. We are not going to, the world is not going to wake up one day and say COVID is gone. Yeah. We have to learn to live with it.
Professor, you did mention that the lockdown is not essential for all sections of the population. A certain section of people can still continue with their routine work as normal. But in such circumstances, would there not be kind of vectors in transmitting the virus?
Absolutely. There is a risk of lifting the lockdown. Just there is a risk. All I'm saying is there is no risk-free option here.
Yeah.
We cannot say this is the perfect solution. No, the lockdown also has damaging effects. Life is all about balancing risks against benefits. Yeah. And I think right now, lockdown seems a sensible option. I worry that this is not a long-term solution. In the long term, we will have to learn to live with the illness. There is another big problem going on, which hasn't caught anyone's attention. Our mental health services, where I work, our work has diminished quite a lot. We are working from home, but routine services have had to slim down. So we have seen two kinds of effects of that. One is people who were already in services, the care that they desperately need, that was keeping them well, that has gone down. The quality, not the quality of the care, but the access, the availability of that care has diminished. So they are getting worse. And then the ongoing stress is creating a new group of people who need help. So it's creating mental distress plus interfering with our ability to provide help to those who were already under care.
Right.
People are in crises more often. I think time will tell. I don't think there is data as yet, but time will tell whether rates of self-harm or suicide have gone up. We don't know, but it is a worry. It is a worry that I used to see patients a lot more frequently than I do now. Many of my patients, the most seriously mentally ill, do not have internet connections for us to do Zoom conferences. In a discipline like mine, a phone conversation is not enough. You need a face-to-face interaction. So some of the most vulnerable from a mental health point of view are the most affected by the lockdown, both due to the lockdown and the effect on services because of the lockdown. And I think we haven't paid enough attention to that.
Yes, with the current situation, the government is also not sure as to the easing of the lockdown measures, and considering a still higher spike in cases and also taking into account the number of deaths.
It is very difficult for any government to know what to do. This is a truly unprecedented situation. There's no manual you can go back and look at. And there is not even, we can say, look at those people. Each country has its own population base, its own service structure, its own healthcare system, and everybody can tell in
Yes.
hindsight what should have been done. I
Absolutely.
can tell you what should have been done 3 months ago. And I have the comfort of doing that. And our press plays on that. Our press will tell you exactly what went wrong and what should have been done yesterday. But they don't have to make
Yes.
the decision of what should be done tomorrow. No government has done really bad or really well. We are all learning. It's like a ship. We are in the middle of a storm, and the captain is desperately trying to steady the ship and stop damage. And there will be time when you will say, well, could we have predicted the weather better? Could we have made the ship more robust? Right now, we just have to steady the ship. And I think we should all get behind the government, because I don't think any other government would have done things differently. We are learning as we go along. I'll give you another interesting statistic. People compare death rates, or look at our death rate. Before the pandemic, 2/3 of all deaths in the world were not recorded. That is 38 million deaths every year. There was no record.
Right.
There are countries that have just started recording deaths because of the pandemic. So how can you compare what the effect of the pandemic has been on death rates in those countries when you didn't even know how many people were dying in that country or in that area? So where people can measure with precision, say in the West, figures look bad, but who knows what's happening in remote rural parts of the world? We don't know.
Yes.
The way you collect death data varies. Is it people who die after testing positive, or people who die after developing symptoms? These are very different groups, and different countries are collecting data very differently. So I think from the government point of view, I feel for the politicians, they have to make very difficult choices. I know some people on the scientific committee, and they are dedicated, hardworking doctors. There is a view that science has an answer. Things are yes or no. Science is not like that. There is always a degree of uncertainty.
Yes.
And science is about what does the evidence at best say at this point in time. Tomorrow, new evidence may emerge, and all our ideas may prove to be wrong. Science moves by proving previous ideas wrong with new evidence emerging. The impact of the pandemic on mental health or on economy, on young people, it'll take us 5-10 years to really work it out. But of course, people want answers now. Politicians are under pressure to deliver it now. I feel for people who are in the position to make decisions. I can sit and criticize, and that's easy to do with the wisdom of hindsight. But it's an evolving situation, and we don't know. Nobody knows how things will plan out. Because I don't think anyone has a specific answer. I'd be worried if people start saying, this is exactly what we should do.
Fair enough. We are still in a very uncertain situation. Yes.
I have a chair in a Danish university. I know I've worked all over Europe. Different European countries are trying different things. Sweden tried one model, not having a lockdown. Denmark tried another. Germany tried a third. Now there are isolated examples, not isolated. Well, in Southeast Asia, for instance, places like Vietnam have done very well. South Korea have done very well. And there is a reason for that. You remember the SARS epidemic that started, the bird first came to those countries, and they really had to deal with it. It didn't affect the West as much, and it got stopped quite early. Those countries developed systems to deal with the pandemic. We should have done, again, this is hindsight. The research on SARS, which started, large amount of money was poured into SARS, but once the illness stopped, all that research went away. Now, in hindsight, had we learned the lessons from SARS, we could have applied them now. Now, we will learn lessons from this pandemic. Next time, something else will happen.
Yes, absolutely. So true. But in the process, many lives are lost.
Many lives are lost, and death is not a technological challenge. Death is an inevitability. We can prevent some. We should improve people's health. But in the scale of epidemics, if you look at the plague in the Middle Ages, or even the Spanish flu, the flu of the 1918, we are not there yet. We are not in that difficult a stage. I hope we don't get there. I don't think we will. It's remarkable, absolutely remarkable, how quickly a vaccine has been produced. Never in the history of humanity have been able to do something this striking. For a completely new disease, As it is unfolding, science has worked out which vaccine is effective. That's absolutely remarkable.
Also, I'm intrigued, with the surge of cases and the hospitals being under extreme pressure to handle this crisis. What is the impact on the NHS frontline and the staff?
Anecdotally, it's been very tough. It's been very tough, especially those at the front end, those working in ICUs. You've got a limited number of ICU beds. You've got a limited amount of equipment. You've got to make life and death decisions, where to continue treatment, where not. I've spoken to one colleague, and it's extremely distressing. Doctors do it, but you have to make these decisions once in a while, even in an ICU. Now you're doing it at scale, and you're watching people die, and there's no one to even hold their hand. They're desperate to speak to their family. I think it's been terrible. So many staff are shielding as well, that the work, not just because of the pandemic, but because of the effect, so many people are unwell or shielding. A small number of staff are doing a disproportionate amount of work. It's heroic. I think we will, if ever you wanted to see the strength of the NHS and how good it is,
Sure.
this is the time. Despite the scale of the pandemic, the NHS hasn't become completely overwhelmed, like the pictures you saw from Italy, with people dying in corridors in Brescia, in Italy. In the first wave, people were dying in corridors without attention. It was like something out of a horror movie. Here, very close to where I live, within 2 weeks they created a Nightingale Hospital from a conference center, fully functioning. The impact is very severe. The mental health impact of dealing with the COVID is very serious on NHS staff. They are doing a fantastic job. But I think at some stage, we will have to start paying attention to how to deal with this. As I understand it, research bodies have already funded studies on the impact of the pandemic on the mental well-being of staff, NHS staff. I know at least 2 studies that are already going on. So anecdotally, the impact is very severe. The exact magnitude we'll find out as this research gets completed.
Right. Professor, with the lockdown and the schools all happening online, particular concern is for the young children who are not able to, or who are not rather capable of expressing their fear, stress, or anxiety well. And with the lockdown and staying at home most of the time, I think it has got a great impact on their mental health too. What are your views on this?
Oh, absolutely. Absolutely. Now, I'm not a child expert, but speaking to my child specialist colleagues, they are seeing an increase in number of referrals. And you have to understand that by the time a child gets to see a psychiatrist, only a small fraction of those who are struggling end up seeing a psychiatrist, because the family has to recognize it's a problem, the GP has to recognize a problem, and they have to send a referral, and the referral has to meet a level of severity for intervention to take place. So for every one person who ends up coming to services, there are 6 or 7 who are struggling because they're not either ill enough or nobody has picked it up. Again, and like you said, one of the things you said was children's ability to express their uncertainty, very young children. And the other group that you mentioned earlier, people with learning disability or autism or people with neurodevelopmental disorders, we know that they struggle to express their emotions.
Sure.
All I can say is that parents need to be as open and as honest with their children as possible. Children work out if you're not telling them the truth. Even very young children work out if you're not telling them the truth. So if you give them false assurance, when they know you're worried, they will think the worst is going to happen. In their imagination, things will be even worse. So I think we have to tell our children what the reality is. Give them hope, but not sugarcoat things. There is hope. We will not be in this stage at the end of this year. Whatever happens with the vaccination and with the economic impact, we will have to lift. That's my guess. I can't tell you, I have some inside knowledge. My feeling is that things will gradually return to some form of normalcy. We may not go back to how things were before the pandemic for some years to come.
Right.
We will return to some form of, or a better way of going about our daily business. Meanwhile, I think it's very damaging. I wish I could say something positive. There is no there is no positive of this pandemic. It's been dreadful, absolutely dreadful.
The other important concern, I feel, is the mental health of university students during this pandemic. And that has been of an increasing concern. The universities, which include the students as well as the staff across the UK, are very much challenged. What is your advice?
University students, particularly those like my daughter, who are stuck. No, they can't come back home. They are stuck at university. Some are stuck in residential accommodation, and they're in lockdown. Students at that particular age, your peer group is very important to you. Your social interactions, they are much more important than your family. That's also being taken away. I think with the best will in the world, online teaching cannot be the same as face-to-face teaching. This is my impression. And I think a lot of learning happens through interaction. A lot of learning happens through mutual learning in a group. University students already struggling with debt and with financial pressures. Now, on top of that, have this problem of retaining education and then worrying about where will be the jobs.
Exactly.
I think there's a study going on. I'm not entirely sure. There's a big network of student mental health researchers in the UK. I don't know of any published research so far. So what I'm telling you is anecdotal and experience.
Right.
We will find out that it's been very detrimental. It is very challenging. It's very challenging. I can tell you from personal experience. I worry. I'm working. My wife is working. Our 2 kids are online schooling. I don't know. My son's got a phone in his hand. I don't know whether he's paying attention to the lesson or he's playing a game on the phone. I go and take it away, and he said, no. I need to ask my friend a question. That seems legitimate to me, but I am worried. I can't keep an eye on him. It's very challenging. It's very challenging, and there is no easy way. If I could give you a piece of advice that would help. It would be so commonsensical that you would know it already. There isn't.
Right.
We will find out with time. We just plod on, and I think I'm hopeful because just the miracle of the vaccine. It's remarkable.
Yes.
Remarkable how quickly we found the vaccine.
What's your advice for people who are severely, especially children who are severely affected by mental illness or have additional mental health needs? What would be the strategy to help them cope with through this crisis?
The first thing to do is to get them to express their distress.
Sure.
Quite often, problems become bigger in our head if we don't express them. Our fears multiply. We get anxious, then we get anxious about the fact that we are anxious. Your anxieties have anxieties. And in your head, things become more bleak than they sometimes are. It's absolutely true. I think a very good thing to do is get people to express their distress, say what they are worried about, say what they are scared of, and just helping people express that problem then goes out of your head and it's right there in front of you and you can examine it. Is it this big? Is it that bad? So expressing, getting people to talk, I think is probably the best thing we can do at this stage. And then where people need help, getting help. But things are so difficult with help, with GP surgeries and pandemic. I worry that everyone who needs help is obviously not getting it.
Yeah.
Can do something in our own space, getting people to talk about their worries and expressing them and sharing them. Sharing a problem is often part of solving the problem.
That's very, very useful information. The government has issued guidelines to the public regarding mental health during the pandemic. What are your views on this? What else can be implemented further in addition to these guidelines?
These are again things that are very simple. Stay connected with others.
Sure.
Stay connected with nature. Nature has a very healing effect. Even if you're stuck in a flat, you are allowed to. And stay connected with yourself. Be mindful. And I think these are simple things. These are the equivalent of, in physical health, we have 5 a day.
Sure.
Staying connected with others and staying connected with nature are definitely 2 of the 5 that I can recommend. Things like music and art, they are really helpful. So there are I have a colleague who's a professor of music who's working with young people. You get now orchestras with individuals playing in their own homes. I heard Ravel's Bolero played by a group of young people, each one in their house. Beautiful sense of togetherness and accomplishment, dance, movement. Movement is very good for you. Movement is very good. I shouldn't be telling you. You are the expert on this.
No.
But movement is very good for your well-being.
True.
Whether that is physical exercise or whether that's dance. So the creative arts are a great source of solace and have always been. So there's nothing stops us. Now we've got, for the first time in human civilization, I have the entire creativity of humanity at my fingertips. Bach was forgotten in Europe till Mendelssohn brought him back in the 18th century. He was all but forgotten. I have now the work of every great artist on YouTube and Spotify. So we are very blessed in that way.
Yes.
All of human creativity is at our fingertips. And I think we should take advantage of that. Learn a skill. There are so many courses now online. Learn a skill, keep your mind occupied. Get a sense of achievement.
Right.
And all of these are markers of achievement,
True.
Getting a new skill, learning a dance, mastering an instrument. You know all this better than I do. There is this thing that people suffer from low self-esteem and they don't do things. And I often tell my patients that you don't have to first fix your self-esteem so that you can go out and achieve something. Try and achieve something. Your self-esteem will improve. True. Achievement has to come first. But don't worry about, I don't feel confident, so I will not do it. Do it despite not feeling confident, and your confidence will emerge. Mastery over even small things really is good for us. People want two things really in if you think in psychological terms, great human needs. One is the ability to master your life, have some control over your life. And the second is to be understood. So mastery you can do. To understand, you need others or to be understood.
That is so beautifully put. Very, very insightful. Thank you for sharing such valuable information. Thank you so much for your time, Professor.
Thank you very much. It's been lovely talking to you.
Thank you.